Hey, I'm Liamith,
My name is Jay, and welcome back to the Medical Frontier.
where we talk about today's inventions, which are tomorrow's standard of care.
Yeah, so in this episode, we're going to be talking about some neuroimaging techniques, specifically CT scans, MRIs, fMRIs, PET scans, and also a new feature that might be coming out soon, and how it'll be really revolutionary in the neuroimaging world.
Yeah, so starting off with fMRIs. So, fMRI stands for functional magnetic resonance imaging, right? And so, what this does is it gives us a scan of the brain's activity and the brain's function. So, how this kind of works is the participant will be asked to do a task, and the MRI will obviously take a photo of their brain activity while doing that task. And then after that, or before that, they will have a photo taken of that brain at rest without any movement or whatnot. So with this, they overlap the images and are able to see the difference in the brain activity. And you might be wondering, so how is that brain activity measured, and how do we know that that part of the brain is being activated? So just like anything else, your neurons require ATP. Just like to pick up my hand, I need energy and whatnot. So when ATP is used and stuff like that, there's an abundance of oxygen and there's more blood flow of oxygen to that part of the brain. So what the MRI is doing is recording the oxygen throughout the brain, and where oxygen is more abundant, that's how we know that the brain is especially active in this area and not another area.
Yeah, so how it specifically does that is it uses it or it traces or it measures something called the Bold signal, which stands for blood oxygen level dependent signal, and it basically just tells you like how the blood is flowing through the brain, and because we know that the areas of the brain that are being used at the moment, those are the areas that require the most blood flow. So it tracks where the blood is flowing, and it does it by detecting that signal. And another type of neuroimaging technique that they have now is called CT scans, and those have been around for a really long time, right, Liamith? I think those are actually one of
Yeah.
the earliest types of scans. And so those aren't like actually the most high resolution. They're actually not, as accurate as the other ones that can detect structural parts of the brain. So how a CT scan works is that at first it takes like X-rays of different parts of the brain, like the front of it, the back of it, sides of the brain, and basically it just combines those two parts, or it combines the multiple X-rays and images that it takes, and it creates one overall image, and it can help show like major structural disturbances like tumors, and it can't show you exactly what's different, or it can't show you exactly like the small details, but it can show you big stuff like tumors and any deformities that there might be. And then, as Liam has talked about fMRI, like another one is called the MRI. So the difference between fMRI and MRI is that fMRI is functional, meaning it tracks the function of the brain and what's going on in the brain right now. But MRI only tracks the structure, which is similar to the CT scan. So how MRIs work is that first there's, because it's in a strong magnetic field, the MRI and the fMRI, it aligns hydrogen protons. Liam, if you want to explain a little bit more about like how strong the magnetic field is.
Yeah, so with each MRI machine, there's a different strength of magnet, right? So it goes from T1 all the way up to T7. And so the T stands for Tesla. So now what the machine has, the power of that magnet is unchangeable. That is the set machine's magnet. So T1 is the weakest and T7 is the strongest. Usually the basic MRI machine would be around T2. If you needed to adapt to somebody who had an implant or whatnot, it would be T2.5 or something on the lower end of the spectrum. And the interesting thing is when we take the scans of different strengths of the magnets, right? If we take a T2 scan opposed to a T1 scan, it shows up differently, and the image itself represents different parts based on the shading of the regions, right? So I'm gonna screen share something really quick. Um, yeah, so here is the T1 scale, or the T1 image, and the T2 image here. So you can see that fat in the T1 image is signified by white, and in the T2 image it's signified by gray. And white matter in the T1 image is light gray, and in T2 it's dark gray. So with each image there's a different key. So if you get handed a neural image and you don't know what magnet was used, then you have really no way of analyzing the image, which is why things like keys are important. Like, it's again used in the healthcare field just like this, and it's really crucial to see the difference and to know what type of magnet was used to identify the proportions, and to see if all the if there's enough fat, if the white matter wasn't there and whatnot and stuff like that. So yeah.
Yeah, so basically, all that's trying to say is that they use a
Yeah, and
really,
I
really
think that
strong.
when we're talking about fMRIs in general, it's very, very easy to get carried away and talk about what all that could happen from fMRIs and whatnot. And there's very little in terms of the structural integrity and how that was impacted um, by like head trauma, for example, and stuff like that, that you can't really see without doing an autopsy or a different type of scan.
Yeah, so what's that basically saying is that, there's a huge magnetic, field that's being used for both of these types of scans, fMRI and MRI. And so how the MRI works is that, once the patient is placed inside that magnetic field, the hydrogen protons, which act like mini bar magnets, they actually align with that magnetic field. And to disalign the hydrogen protons, they actually fire radio waves at the patient. And when those radio waves are fired, it actually misaligns like how the protons are spaced inside the brain, which, like I said, act as radio magnets. And then when they take away those radio waves, when they stop firing those radio waves, the hydrogen protons, they go back to their original position. And when they go back to the original position, that instant where that happens, it emits some energy, and that energy and how long it takes to go back to that original position is what's tracked by the MRI technology. And how that happens is what's being tracked as an image, and it shows up on a monitor screen where we can see the structure of the brain.
Yeah.
And then another type of neuroimaging technique is a PET scan. And out of all of these, I think PET scan might be the most intensive or the most complicated. At least that's what I think, in my opinion. And how that works is that first, a patient is injected with a radioactive substance called a tracer. And normal, most of the times, that's a glucose, a radioactive form of glucose. And what happens is that to make that tracer, they have to go to a cyclotron machine, which is like they have in like another part of the hospital, and they have to do that like about 2 to 3 hours before the patient is required to do their PET scan. And that causes some challenges because with all these other technologies, you don't really have to take that extra time, or you need the extra machinery like a cyclotron to make the radioactive glucose and whatnot. So there's some time pressure involved in that, and also extra costs with maintenance of the cyclotron. So what happens is that once the patient is injected with that tracer, and once it's inside the body, it's in the blood, so it goes into the brain when the brain is active, which is most of the time, or when they're doing like a highly intensive task. So once the tracer is in the brain, it releases something called a positron. So a positron is basically the antimatter version of an electron. It's kind of hard to explain. It's not the same thing as a proton, but it's the best way to explain it is an antimatter version of the electron. So once that is released by the tracer, and when the positron collides with an electron, it creates like an explosion. And that explosion releases gamma rays on both sides of where that explosion happens. So since the PET scan is like just a round machine where that can detect like where the gamma rays are hitting, and when those two gamma rays are emitted from that the explosion site, that is tracked by the ring that's called the PET scan, and it can show you exactly where the blood flow is happening and whatnot in the brain. So that's basically how a PET scan works.
Yeah, that's very interesting to see how all these different types of radio and how magnets and everything plays its own independent role into it, as you said, with PET scans, and how gamma rays are involved, and how the hydrogen atoms are involved in regular MRIs, and the alignment and the misalignment, and how they're affected by radio waves as well. And when you're talking about those radio waves getting affected, that's why even that MRIs rooms have to be completely vacuum sealed,
Exactly.
and that there also needs to be any copper filling or that type of insulation to not get impacted by any type of signals like radio waves. There was actually an instance where and a physician allowed patients to take their phone into the MRI room and listen to music, and it had never been an issue because it was a low magnet. It was only I think it was T2 or T1.5. It was a very basic magnet, so it wasn't getting affected. So they're like, okay, whatever, we'll keep using it. And then a patient had their phone, and they obviously can't hear outside of the MRI. All they do is see in, right? And the patient got a phone call, and it obviously messed up the signal, and it just showed like up and down, up and down, up and down on whatever they were reading to see the signals that they were sending in, and they were very confused. And it was affected by the phone call and how those radio waves got interfered with the machine and whatnot. So these
Right.
small little things, and how you have to be extra cautious in terms of MRI safety as well, and about how strong the magnet is, that if you have a certain type of metal, like you guys always see, again, we're referring back to the medical shows where they forget the MRI machine is always on. So if somebody goes in with something metal related and the patient gets thrown up against the MRI machine, like pinched, and they have to come in with like whatever to leverage them off of it, it's a
Right.
whole mess, which is why that these machines, especially MRIs, are very easy to mishandle, and it's very important to have the proper safety procedures when going about that.
Yeah.
And with that, I think we can go ahead and talk about not the MRI, but something else that also has recently came out.
Hmm.
And what it does, it's a neuroimaging, but portable. And so what this does is it's kind of a cap, and it basically does the same thing as an fMRI, but the functionality of this is for situations that, one that was brought up especially was during cardiac bypass surgery. There's the risk for brain ischemia, which is lack of blood flow to the brain, of an oxygenated blood. And so what this cap does is it monitors that to prevent any long-term effects from happening to the patient, so that they know that the patient is getting the correct amount of blood supply and oxygen supply to their brain.
Hmm. Yeah, so the main, I think we can all agree that with the neuroimaging techniques we discussed earlier in this video, they're all like big, heavy machines that are really expensive, and they take a lot of time and care to maintain them. And with something like this, it's called the HD dot, which stands for high density um, detection device, basically. Diffuse optical tomography, that's what the DOT stands for, HD dot. Or sometimes it's also called the wearable HD dot. So basically, the patient wears this sort of cap looking thing. If we can pull up an image of that, Liamith, I think it'd be really helpful.
Yeah.
So the patient wears this sort of cap, and it can detect the functional aspects of what the brain is doing, or how the blood is flowing to the brain when they're, doing different types of activities, whether it may be like a normal routine activity like walking, sitting down, watching TV, or something like that, or even like something more intensive, like maybe, if they're taking an IQ test or something along those lines. And it's really cool because this is portable, like Liam had said. So, it can detect, mostly everything that an fMRI can, since it covers, most of the head. So if there's any visual stimuli that the brain is interpreting, so since the cap covers like all parts of the brain, it can, measure the activity in the occipital lobe. If there's some hearing stimuli that the brain is interpreting, it can measure the activity in the temporal lobe, and that's the basic gist of it. And
Yeah.
so some key advantages are that it's compact, lightweight, and variable. Well, Liam, were you going to say something?
Yeah, I was just gonna say, like, as you were talking about, the fact that it's portable allows for the hope of that this could potentially get into operating rooms for, as I said, cardiac bypass surgery and on-site emergency response to see and assess the situation quickly to provide, the applicable care required in order to maintain the safety and health of the patient. And as we said last episode, time is money in healthcare, especially, and to be able to assess that something is wrong quicker than later is obviously always a very good thing. And that's the goal with this. And yeah, just go ahead and continue what you're saying.
Yeah, so one thing that it does lack is that it's not as sensitive as an fMRI, but since it is portable, it makes up like huge aspects along that. And another pro about the wearable technology is that it can actually be compatible with electronic implants since it avoids like the electromagnetic safety concerns of fMRI. So it's actually compatible with like pacemakers, cochlear implants, and also deep brain stimulation um,
Hmm.
methods as well.
Yeah, and so going again, talking about those implants and how it's talking about how the lower the lower T value that we would have to use in order to not, to be safe. In regards to the T value again, the difference in terms of just besides the strength of the magnet is the quality of the image of that you're going to be getting out of it. So the higher the T value, so if it's a T7, that's going to be a much clearer image than a T1. So that's why again that it's good that the implant is not getting affected by this, because regardless if you have an implant or not, you're going to get the same image out of this out of everybody, wherever you use it.
Right, right. And I think there's only like a couple things extra that I can really think of that, might be important when considering this device is that one thing is, since it is wearable and the purpose of it is to track like everyday activities of the patient that wears it, I think something that you have to consider is how you maintain and take care of this technology. So if it's in the hands of the patient, it's most of the time not going to be visible to like a professional who knows how this works or who knows how to maintains it. So if it's in not in the vicinity of a professional, what I'm trying to say is that the patient has to um, more like be responsible as to how to handle it or more read
Hmm.
into how to handle technology like this since they may not be familiar with how this works.
Yeah, and I think because it's obviously from what we know at least, it's a pretty new technology, and there's a lot of applications for it that people could leverage and do a lot of different things with this situation. Obviously, there's a lot could that needs to go into more, and obviously, it's not a substitute by any means for fMRIs, and obviously they are on their own very useful and applicable for their own reasons. But this technology is not where we want it to be yet, and I think that there's a lot of improvements that could be made on a lot of different ends.
Right.
Um, I think the one thing that you really can't touch on or you can't really improve is the fact that it's portable. Like the fact that you can, it's a light wearable cap, and it's not doesn't take too much to take those images. I think that maybe the resolution of the image, if they could work on that, maybe getting this into hospitals, into places around the country, that would definitely be a huge impact that it would have.
Right. Yeah, and some more future directions. I was also reading another article about how they're trying to implement AI and generative AI and machine learning into a lot of like medical neuroimaging techniques. So since we know that like in households now, there's probably a lot more devices that are capable of like, phones or tablets or laptops. They're a lot more capable, I feel, than like some of the equipment that there might be in hospitals when it comes to, harboring those AI technologies, machine learning technologies. So if it's portable enough as to where you can wear it in your own house, and if they can somehow, connect those computer science or machine learning models into a device like this, it could also be a really big breakthrough since they're also already trying to work on how they can implement those things into neuroimaging. So that's just another future direction that they can consider going.
Yeah, I think there's a lot to go with this, and excited to see how this impacts neural imaging as a whole. And I think this was a great episode. It was a great new technology that we think could impact neural imaging, and I think we've covered a pretty broad, diverse amount of topics thus
Oh yeah.
far. I think we went from heart in the box to this, which is two completely unrelated things, like imaging to actual functional practical usage of technology.
Yeah,
So
well, I learned a lot doing research for this episode. I'm sure Liam and you also learned a lot. And
definitely.
please let us know down below, guys, what else you'd like us to talk about or what else you'd like us to learn more about and share with you guys. And, it's always a learning experience for all of us. We learn about these and make the video for you guys or these episodes, and you guys come along, watch, and learn with us. So this was a great
Yeah.
episode.
Yeah, thank you guys so much for watching, and we'll see you guys next time.
Peace, guys.